Welcome back, everyone, to Beyond the Big Top Circus-Based Interventions and Occupational Therapy. So, this will be the fifth episode, the final episode of this mini series titled The Bigger Picture Rethinking Therapy Through Circus. So, this last episode explores behind the circus-based intervention and what it reveals about occupational therapy as a whole. This episode will reflect on the deeper principles that make circus meaningful within the practice. So it's patient-based care, creativity, inclusions, accessibility, and strengths-based participation. And these are just to name a few. But this episode invites us to think beyond circus itself and consider a larger question. What does circus teach us about therapy? So the message that I did want to leave is that circus challenges us to rethink what therapy can be. Throughout this series, we have explored what circus-inspired intervention is, how it supported therapeutic goals, how activities can be analyzed and adapted, and why engagement plays such a powerful role in participation. So beyond scars, juggling, balancing, and movement challenges, there's so much more, something bigger that's happening. Circus offers a lens through which we can re-examine therapy itself. And at the heart of occupational therapy is a foundational belief that people thrive when they engage in meaningful occupations. So, occupational therapy is not simply about improving isolated skills. It is about supporting participation in activities that matter to the individual. This is what makes surface-based or circus-inspired interventions so powerful. It creates opportunities for exploration, connection, expression, self expression, and participation as well. And this reflects one of the core principles of occupation based practice. And in occupational therapy, we understand that people are often more motivated and more engaged when interventions feel purposeful and meaningful. Activities that hold personal meaning naturally encourage participation, persistence, that emotional investment as well. Circus embodies that idea. Help brings some sort of a challenge, creativity, and play. And the same therapeutic goals may still be addressed: coordination, endurance, attention, phalanx, motor planning. But the pathway is just a little bit different. And therapy can also be creative, which is already occurring in the occupational therapy field and the practice. So it can be expressive, it can be playful, it can involve imagination or exploration, joy. Circus reminds us that therapeutic intervention can move beyond traditional expectations. A creative intervention can still be evidence informed and goal directed. In fact, creativity can expand across to participation. Participation is highly adaptable. Circus is not limited to a specific skill level, age, or functional ability. With thoughtful adaptation, almost anyone can participate if they cannot perform a task in a specific way. Circus-based innovation shifts the focus away from perfection and toward participation. Each of these moments matter. Each represents meaningful participation. This perspective reflects a strengths-based approach, which is central to occupational therapy. A strengths-based approach focuses on what the person can do rather than what they cannot. And instead of beginning with deficits, limitations, or impairments, we begin by identifying strengths, interests, capabilities, and possibilities. Circus supports this naturally. A person who struggles with one activity may excel in another, and someone else with limited values may show strong creativity. Someone with motor challenges may demonstrate excellent problem solving or persistence, and someone who is hesitant socially, which I've seen across some of the sessions with some of the kiddos in the pediatric summer camp, may gradually develop confidence through shared activities. This matters because strengths can become powerful entry points for therapeutic growth. And when individuals experience success, confidence often follows or grows. And when confidence grows, participation often increases. Circus also reminds us that progress is not linear. Progress rarely follows a perfect upward path. Some days feel easier, some days feel more challenging. Progress can vary differently across the board. It depends on the person. And progress may mean improved coordination. For another, it might mean improved confidence. For someone else, progress may mean simply showing up and trying. That all matters. Therapy is not always about a dramatic transformation. Sometimes progress is found in small moments of courage, persistence, and participation. It normalizes mistakes because mistakes are going to happen. In one of the episodes, you saw me like walk across the balance beam and step over to catch my balance. Mistakes happen. It celebrates effort. This has implications far beyond surf, and ultimately, circus-based intervention is about much more than circus skills, creativity, and possibility. It reminds us that therapy can be dynamic, human, and deeply meaningful. It reminds us that participation matters more than perfection, and it reminds us that every person deserves opportunities to engage. The core message of this episode and this entire series is simply Circus challenges us to rethink what therapy can be. I really appreciate everyone who's tuning in. Please check out the other resources. They will be listed on my channel and also in the description of this video. Links for the link tree with all of the resources. There is, of course, this YouTube channel with videos of a mini series for circus and OT, or circus inspired activities in OT. There's also a website that I created, and then also there's a toolkit that you guys can check out. I hope that everyone enjoyed the content, and thank you so much, and I really appreciate it. Take care.